Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita, and I will be a guest today as well. Ron will not be with us today.
Okay, and I'm here.
She is Jean Marie. Collectively, we are the crew of PodcastDX.
Catch us on our float.
On today's show, we're diving into a topic that's not often talked about, but affects a lot of people.
Diarrhea.
That too. Abdominal adhesions. We're going to talk about what they are, what causes them, and the problems that they can create.
Right, so let's start with the basics. Abdominal adhesions are bands of scar tissue that form between abdominal tissue and organs. Normally, these surfaces are smooth and can slide past each other like butter, but adhesions make them stick together.
And that sticking can lead to some significant issues.
Like diarrhea?
But first, let's get into the causes. What triggers these adhesions to form?
Glue.
Glue? No, don't listen to her.
Okay, the most common cause is actually surgery. And it's not a laughing matter, but I'm very tired.
Okay.
Whenever you have abdominal or pelvic surgery, or any surgery really anywhere, you can during the healing process, scar tissue can form, and the risk increases with the complexity and the number of surgeries you've had in a given area, or how much damage is in the certain area.
Okay. And surgeries like appendectomies, C-sections, which are births through the belly, or procedures to remove tumors are common culprits. But surgery isn't the only cause.
It's glue, right?
Nope. Adhesions can also form from abdominal infections like peritonitis or even trauma to the abdomen area.
Okay, well, let's take a moment and think about this. When you think about it, any process that causes inflammation or damage in an area, like the abdominal cavity, for example, can potentially lead to adhesions. And this includes also like infections like diverticulitis or, like you were saying, like an appendicitis that would result in, hopefully an appendectomy, I guess.
Eventually, yeah.
Yeah. Well, I guess not hopefully. But
While surgery and infections are big causes, don't forget about less common triggers.
isn't that what we were talking about? Less common triggers?
No, those are big causes.
Oh, okay. All right. What's another?
Less common triggers are radiation therapy for abdominal or pelvic cancers can also lead to formation of adhesions over time.
Okay. And just another interesting factor is endometriosis. So for those that aren't familiar with this, it's when tissue similar to the lining of the uterus grows in areas outside of the uterus. And this can trigger adhesions to develop as well.
Exactly. Endometriosis often involves chronic inflammation, and that's a setup for adhesions to form, sometimes leading to pain or fertility issues.
And speaking of chronic conditions, let's touch on Ehlers-Danlos syndrome, or EDS. This is a group of connective tissue disorders that can significantly increase the risk of abdominal adhesions.
That's a great addition. In people with EDS, their connective tissues are more fragile and prone to damage. This makes them more susceptible to the formation of adhesions, especially after surgeries or injuries.
Right, and that's because EDS also affects healing. Adhesions in individuals might be more problematic, leading to tissues like, or issues with the tissues, like chronic pain, or even more frequent occurrences of things like with abdominal adhesions, you might have intestinal obstructions.
That's true.
Okay.
It's a reminder that pre-existing conditions can play a big role in how adhesions develop.
Or whether they will.
Right. And how they affect someone's quality of life. If you have EDS or another connective tissue disorder, It's worth discussing preventative strategies with your doctor before undergoing surgery.
So now that we know some of the potential causes of abdominal adhesions, now let's talk about some of the problems abdominal adhesions can create. And as we had said, one of the big ones is intestinal obstruction.
Yes, adhesions can cause parts of the intestine to kink, twist, or pull out of place, leading to a blockage. When that happens, you might experience severe pain, bloating, nausea, vomiting, and constipation.
And these are no joke. They're a medical emergency and often require a surgical intervention to repair. And it's ironic, isn't it, that surgery can cause adhesions and adhesions can sometimes require more surgery.
Yes, it's a bit of a vicious cycle, I guess.
Is.
Well, let's dive deeper into how adhesions can lead to these blockages.
Okay.
Essentially, when parts of the intestine get stuck together or pulled out of alignment, the normal flow of food and fluids through the digestive system is disrupted.
And symptoms for this can vary. Sometimes people might have mild discomfort, and it might also vary based on the extent of the obstruction. So from anything from mild discomfort that comes and goes to severe cases where the blockage can lead to serious complications like infection or even perforation of the intestine.
Another issue that adhesions can cause is chronic abdominal or pelvic pain, even if they're not blocking anything.
Okay.
They can still pull on the tissues and the organs, causing discomfort or even infertility in some cases.
Okay, and that's a great point. Adhesions in the pelvis, for example, can interfere with the fallopian tubes and ovaries, making it harder for some people to conceive.
Oh, didn't think of that. Would it also make it a higher risk for an implantation outside of the uterus?
I don't know. That's not in my script.
Okay, I was just asking a question.
And I'm not the one who was responsible for this research.
Okay, well, then we'll just leave that for another episode.
Maybe we'll have a link in this episode.
Okay, all right. I'll put a link on the website.
Okay.
Well, let's not forget, adhesions don't just affect the physical body. Chronic pain can have a big impact on mental health, leading to anxiety or depression in some cases. It's important to address both aspects.
Okay. And no, not everybody with adhesions are going to have all the same symptoms. And some people might not even know that they have them until there's an issue.
That's true. It's one of those conditions that can lie just under the radar until it causes problems. So what's the takeaway for our listeners? If you've had abdominal surgery or conditions like endometriosis and you're experiencing unexplained pain or digestive issues, it's worth talking to your doctor.
And prevention is key too. Surgeons will often take steps to minimize the formation of adhesions during procedures whenever they can. For example, they might use things like barrier gels or films to help reduce scar tissue
I never
and
heard of that.
adhesion formation.
Never heard of that.
Okay.
Well, there's also emerging techniques like laparoscopic surgery, which tends to cause less tissue trauma and lower adhesion risk compared to open surgery.
Okay. And let's talk about treatment for those who are already living with adhesions. While mild cases may just require symptom management, some cases might need surgery to remove the adhesions.
Right.
There's the possibility of physical therapy, but we'll talk about that in a second.
Okay. Adhesiolosis, is that the word you were trying to avoid?
Yes.
Adhesiolosis is surgery to remove the adhesions, and it can lead to new adhesions forming. So it's typically reserved for cases where the benefits outweigh the risks.
Okay. And it's all about, trying to decide what's best for you because everyone is, an individual and your specific case may vary. But, and for those dealing with chronic pain, physical therapy or specialized exercises can actually sometimes help improve mobility and reduce discomfort.
Well, there's another potential treatment option, and I think you were alluding to this earlier, deep tissue massage or physical therapy. This technique, performed by trained professionals, may help to break up the scar tissue, improve mobility, and reduce pain caused by the adhesions. While it's not a cure, it can provide relief for some people when used alongside other treatments.
Absolutely. And it's all about awareness. The more you know, the better equipped you are to ask the right questions and advocate for your health and, hopefully get to a place where it's a minor inconvenience and not a day-to-day, encumbrance.
Okay. Well, I think that's all we have for today. We're going to be having as a guest a physical therapist that does therapy for adhesions sometime in the near future, but we'll get into more detail with her when she's on.
Okay.
I think we covered the topic pretty well so far, and thank you all for for taking the time to join us today. If you have any questions or comments related to today's show, or if you would like to be a guest on our show, you can contact us at info@podcastdx.com. You could also go to our website, podcastdx.com. You could sign up for an interview there. We're also on Facebook, Twitter, also known as X, Pinterest, and Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast if you want, or drop us a line. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical diagnosis or advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.